ಚಿದಾನಂದ ನಿಮ್ಮ ಸ್ಟೂಡೆಂಟ್ ಮೇಡಮ್,
ಹಾ
ನನಗೆ ಜೂನಿಯರ್, ಮೈಸೂರು ಕಾಲೇಜ್.
ಅಚ್ಚಾ
ಹೊಸದುರ್ಗ ಮೇಡಮ್,
ಹೊಸದುರ್ಗ.
ಹೊಸದುರ್ಗದ ನಮ್ಮ ಕ್ಲಿನಿಕ್ ಎದುರುಗಡೆ ಕ್ಲಿನಿಕ್, ಅಶ್ವಿನಿ ಕ್ಲಿನಿಕ್.
ಹೌದಾ? ಓ, ನಿಮ್ ಕಾಂಪಿಟೇಟರ್.
ಹೊಸದುರ್ಗ, ಕರೆಕ್ಟ್ ಕರೆಕ್ಟ್, ಹೌದು ಹೌದು.
ವೆರಿ ಗುಡ್. ಹೊಸ ಅಣ್ಣ ಸುರೇಶ್ ಉಮೇಶ್ ಅವ್ರ ಕ್ಲಿನಿಕ್ ಅಲ್ಲ?
ಉಮೇಶ್ ಕ್ಲಿನಿಕ್ ಎದುರುಗಡೆ.
ಅಚ್ಚಾ, ನಾನು ಹೊಸದುರ್ಗ ನಿಮ್ಮೂರಿಗೆ ಹಾಪಿಸ್ಕೊಂಡೆ, ಶ್ರೀರಾಮ್ಪುರಾಗೆ ಹಾಪಿಸ್ಕೊಂಡೆ. ಅವ್ರ ಕ್ಲಿನಿಕ್ ನೋಡಿಲ್ಲಲ್ಲ. ಚಿದಾನಂದ, ವೆರಿ ಗುಡ್. ಆರತಿ ಫ್ರಮ್ ಕೊಯಂಬತ್ತೂರ್, ಶಿ ಹಸ್ ಜಾಯಿಂಟ್. ಅವ್ರ ಮೈಸೂರು ಸ್ಟೂಡೆಂಟ್, ಗೊತ್ತಿದಲ್ಲ ಅನಿಲ್ ಕುಮಾರ್ಗೆ?
ಎಸ್ ಹೌದು ಮೇಡಮ್, ನಾವೆಲ್ಲ ಜೊತೆಲಿದ್ದವರು.
ಹಾ,
ನಮಸ್ತೆ ಮೇಡಮ್. ಟ್ರಾವೆಲ್
ನಮಸ್ತೆ, ಹೇಗಿದ್ದೀರಾ? ಯು ಆರ್ ಟ್ರಾವೆಲಿಂಗ್.
ಹಾ
ಹಾಕ್ಬಿಟ್ಟಿದ್ದಾರೆ ಮೆಸೇಜ್ ಆವಾಗಲೇ. ಬಟ್ ಸ್ಟಿಲ್ ಶಿ ವಿಲ್ ಮ್ಯಾನೇಜ್ ಟು ನೆಟ್ವರ್ಕ್ ಪರ್ಮಿಟ್ಸ್. ಸೊ ಈಗ ನೆಟ್ವರ್ಕ್ ಅಂದ್ರೆ ಎಲ್ರಿಗೂ ಸಿಗ್ಬೇಕು. ಅನಿತಾ
ಮಾಡ್ತಾ ಇದ್ದೇನೆ, ಮ್ಯಾಕ್ಸಿಮಮ್ ಅಟೆಂಡ್ ಮಾಡ್ತೀನಿ. ಇನ್ ಬಿಟ್ವೀನ್ ರೇಂಜ್ ಪ್ರಾಬ್ಲಮ್ ಬಂದ್ರೆ ಮಿಸ್ ಆಗುತ್ತೆ.
ಓ ಎಸ್, ನೋ ಪ್ರಾಬ್ಲಮ್, ಬಿ ವಿತ್ ಅಸ್.
ಹಲೋ,
ನಮಸ್ತೆ ಜಯಶ್ರೀ ಮೇಡಮ್, ನಮಸ್ತೆ ಅನಿಲ್ ಸರ್, ನಮಸ್ತೆ ಎಲ್ಲರಿಗೂ.
ನಮಸ್ಕಾರಮ್ಮ. ಎಸ್, ಚೆನ್ನಾಗಿದ್ದೀರಾ?
ಎಸ್ ಸರ್, ನೀವೆಲ್ಲ ಹೇಗಿದ್ದೀರಾ?
ಡೂಯಿಂಗ್ ವೆರಿ ವೆರಿ ವೆಲ್, ಥ್ಯಾಂಕ್ ಯು.
ಇವತ್ತೆಲ್ಲ ಬಂದಿದ್ದೀವಲ್ಲ ಭವಾನಿ.
ಎಸ್,
ಕಾಣಿಸೋದಿಲ್ಲಲ್ಲ ನೀವು?
ಸ್ವಲ್ಪ ಹೊತ್ತಾದ್ಮೇಲೆ ಕಾಣಿಸ್ತೀನಿ.
ಅದು ಬೇರೆ. ಓ ಸರಿ ಸರಿ, ಊಟ ಮಾಡ್ತಾ ಇದ್ದೀರಾ?
ನಮಸ್ತೆ. ನಮಸ್ತೆ ಅನಿಲ್ ಸರ್.
ನಮಸ್ತೆ ಮಾ, ನಮಸ್ತೆ. ರೈಟ್, ಚೆನ್ನಾಗಿದ್ದೀರಪ್ಪ? ಓಕೆ, ಗುಡ್.
ನಿಮ್ಮ ಜೊತೆಲಿಂದ ಶೋಭನಾ ಅವ್ರಿಗೆ ಜಾಯ್ನ್ ಆಗ್ತಾರೆ ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ಹೊತ್ತಿಗೆ. ನಿಮ್ಗೆ ಜೂನಿಯರ್ ಅಲ್ಲ ಶೋಭನಾ? ಶ್ರೀಪ್ರಸಾದ್ ಎಲ್ಲ ಜೂನಿಯರ್ ಅಲ್ಲ ನಿಮ್ಗೆ? ಅಲ್ಲ, ಹೌದು, ಶ್ರೀಪ್ರಸಾದ್ ನಿಮ್ಗೆ ಜೂನಿಯರ್ ಅಲ್ವಾ?
ಹೌದು ಮೇಡಮ್, ಜಸ್ಟ್ 1 year.
1 year, ಯಾ.
ಶ್ರೀಪ್ರಸಾದ್.
ನಿಮ್ಮ ಬ್ಯಾಚ್ನವ್ರು ಇದ್ದಾರೆ ಪಾಪ, ರಿತಿಕಾ ಒಬ್ಳಿಲ್ಲ.
ಮಿಸ್ಸಿಂಗ್ ಹರ್, ಹೌದು ಮೇಡಮ್.
ಯಾವಾಗ್ಲೂ ಎಲ್ಲದಕ್ಕೂ ಇರೋಳು ನನ್ನ ಜೊತೆ ಪಾಪ.
ಹೌದಪ್ಪ,
ವೆರಿ ಸಪೋರ್ಟಿಂಗ್.
ಇಟ್ಸ್ ಮ್ಯಾಮ್.
ಮೇಡಮ್, ಇದು ದ ವೀಕ್ ಮ್ಯಾಗಝಿನ್ ಅಲ್ಲಿ ಅವರು ಆಯುಷ್ ಕಾನ್ಕ್ಲೇವ್ ಅಂತ ಹೇಳಿ ಮಾಡಿದ್ರು. ಅದಕ್ಕೋಸ್ಕರ ಹೋಗಿದ್ದೆ. ದೇ ವಾಂಟೆಡ್ ಮೀ ಟು ಸ್ಪೀಕ್ ಆನ್ ಆಲ್ ದಟ್. ಅಲ್ಲಿ ಏನಂತಂದ್ರೆ, ಈ ITC ಕಾರ್ಪೊರೇಟ್ ಶೆಫ್ ಬಂದಿದ್ರು. ಅವರು ಮೊನ್ನೆ G20 ಮೀಟಿಂಗ್ ಆಯ್ತಲ್ಲ, ಎಲ್ಲ 20 ಕಂಟ್ರೀಸ್ ಇವ್ರು ಬಂದಿರಲ್ಲ, ಪ್ರೆಸಿಡೆಂಟ್, ಪ್ರೈಮ್ ಮಿನಿಸ್ಟರ್ಗಳೆಲ್ಲ. ಅವ್ರಿಗೆಲ್ಲ ಇವರು ಅಡಿಗೆ ಮಾಡಿಟ್ಟವ್ರು, ಮೋದಿ ಅವರು ಅವ್ರನ್ನೇ ಚೂಸ್ ಮಾಡಿ ಕರೆದು ಎಲ್ಲ ಮಾಡಿಸಿದ್ದು. ಆಯ್ತಾ? ಶಿ ಸ್ಪೋಕ್ ಆನ್ ಓನ್ಲಿ ಆಯುರ್ವೇದ. He said, I am not Ayurveda professional or whatever it is, but I have learned it. And ಈ ಋತುಚರ್ಯದ ಬಗ್ಗೆ ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ರು ಅಂತಂದ್ರೆ, ಸಮಟೈಮ್ಸ್ ನಾನು ಅವ್ರದ್ದು ಸ್ಲೈಡ್ಸ್ ಎಲ್ಲ ಕಾಪಿ ಮಾಡ್ಕೊಂಡಿದ್ದೀನಿ. ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ರು. ಇದು ಈಗ ಮಾಲ್ಗಳಿಗೆ ಹೋಗಿ ಯಾವ ತರಕಾರಿ ಹಣ್ಣುಗಳು ಏನು ತರಬೇಡಿ, ನೀವು ಲೋಕಲ್ ಯಾರು ಬೆಳೆಸ್ತಾರೋ ಅಲ್ಲಿ ಲೋಕಲ್ ಅಲ್ಲಿ ಸಿಗೋದ್ ಮಾತ್ರ ತಿನ್ನಿ ಅಂತ ಭಾವ ಪ್ರಕಾಶ್ ಹೇಳ್ತಾರ. ಲೋಕಲ್ ಇರೋದೇ ಅಲ್ವಾ? ಯದ್ದೇಶ ಯೋಜಾತಃ ತಜ್ಜೌಷಧಂ ಮಿತಂ ಅಂತ ಹೇಳ್ತಾನಲ್ಲ, ಅದೇ ರೀತಿ ಆಹಾರ ತರಕಾರಿಗಳು ಅಲ್ಲಿಂದನೇ ಮಾಡ್ಬೇಕು, ಇದು ಮಾಡ್ಬೇಡಿ. ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ರು. ಆಯುರ್ವೇದ ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ರು ಅಂತಂದ್ರೆ ಐ ವಾಸ್ ಅಮೇಸ್ಡ್. ಆಮೇಲೆ ದೆನ್ ವಿ ಹ್ಯಾಡ್ ಡಿಸ್ಕಷನ್. ಹೇಳಿದೆ, ಷಡ್ರಸದಿಂದ ನಾವು ಆರ್ಡರ್ ಏನಿದೆಯಾ ಅಡಿಗೆ, ನೀವು ಅದನ್ನ ದಯವಿಟ್ಟು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿ ಅಂತ. ಯಾಕಂದ್ರೆ ಎಲ್ಲರೂ ಡೆಸರ್ಟ್ ಕೊನೆಯಲ್ಲಿ ತಿಂತಾರೆ. ಡೆಸರ್ಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಈಟನ್ ಇನ್ ದ ಬಿಗಿನಿಂಗ್. ಶಿ ವಾಸ್ ಆಸ್ಕಿಂಗ್ ಮಿ ವಾಟ್ ಈಸ್ ದಿ ಸೈಂಟಿಫಿಕ್ ರಾಷನಲ್ ಅಂತೆಲ್ಲ ಕೇಳಿ ಶಿ ವಾಸ್ ಅಮೇಸ್ಡ್. ಆಯುರ್ವೇದ ಇಷ್ಟೆಲ್ಲ ಗೊತ್ತಿದೆ, ಇಷ್ಟೆಲ್ಲ ಇದೆಯಲ್ಲ ಅನ್ನೋದು. ಶಿ ವಾಸ್ ಎಷ್ಟು ಸೈಂಟಿಫಿಕ್ ಅಂತೇಳಿ ಶಿ ವಾಸ್ ಸೇಯಿಂಗ್, ಐ ಬಿಲೀವ್ ದಟ್ ಬಟ್ ಐ ನೆವರ್ ನ್ಯೂ ದಿಸ್ ಕಾನ್ಸೆಪ್ಟ್ ಅಂತ. ಆತರ ಇಟ್ ವಾಸ್ ಎ ವೆರಿ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಕಾನ್ವರ್ಸೇಷನ್. ದ ವೀಕ್ ಅಲ್ಲಿ
ಒಳ್ಳೆದಾಯ್ತು. ಯು ಕುಡ್ ಗಿವ್ ಹರ್ ಗುಡ್ ಇನ್ಪುಟ್ಸ್.
ದ ವೀಕ್ ಇನ್ಸ್ಟಾಗ್ರಾಮ್ ಇದೆ, ಎಲ್ಲಾರು ನೋಡ್ಬೋದು ಒಬ್ಬರು. ಆಮೇಲೆ ಒಬ್ಬೊಬ್ರದ್ದು ಈಶಾ ಗುಪ್ತಾ ಅಂತೇಳಿ ಸಿನಿಮಾ ಆಕ್ಟ್ರೆಸ್. ಶಿ ಕೇಮ್ ಓನ್ಲಿ ಫಾರ್ ದಿಸ್ ಕಾನ್ಫರೆನ್ಸ್ ಫ್ರಮ್ ಮೆಡ್ರಿಡ್ ಅಲ್ಲಿ. ಶಿ ಹ್ಯಾಸ್ ಅ ರೆಸ್ಟೋರೆಂಟ್. ಶಿ ಇಸ್ ರನ್ನಿಂಗ್ ಇದು ಹರ್ಬಲ್ ಅಂಡ್ ವೆಜಿಟೇರಿಯನ್ ಫುಡ್. ಅಲ್ಲಿಗೆ ತುಂಬಾ ಡಿಮಾಂಡ್ ಅಂತ. She came only for that purpose, and then she was talking high about yoga. ಯೋಗ ಇಲ್ದೆ ನನ್ನ ಜೀವನ ಇಲ್ಲ, ಜೀವನ ಯೋಗ ಇಲ್ಲದೆ ಇಲ್ವೇ ಇಲ್ಲ ಅಂತ. ಆತರ ಅಷ್ಟು ಚೆನ್ನಾಗಿ.
ನೋಡಿ.
ಆಮೇಲೆ ಒಬ್ರು ನ್ಯೂಯಾರ್ಕ್ದು ವೆರಿ ಫೇಮಸ್ ಮಾಡೆಲ್ ಆಯ್ತಾ, ಶಿ ವಾಸ್ ಬಾರ್ನ್ ಇನ್ ಬೈಲ್ಕುಪ್ಪೆ, ಇದು ಎಲ್ಲಿ ಕೊಡಗು ಆಯ್ತಾ. ಅಲ್ಲಿಂದ ಅಲ್ಲಿ ಹೋಗಿ ಶಿ ಹಾಸ್ ಟೂರ್ಡ್ ಆಲ್ ದ ಕಾಂಟಿನೆಂಟ್ಸ್ ಅಂಡ್ ಶಿ ವಾಸ್ ಅವ್ರ ಮನೇಲಿ 300 ಪೇರ್ ಶೂಗಳಿದಾವಂತೆ, ಚಪ್ಪಲಿಗಳು, ಶೂಗಳು 300 ಪೇರ್. ಅದ್ ನೋಡಿ ಆಕೆ ಬಿಟ್ಬಿಟ್ಟು ಈಗ ಲಾಮಾ, ಆರ್ಯ, ಅರ್ಲೋನಾ ಅಂತ ಏನೋ ಆಗಿದ್ದಾರೆ. ಲಾಮಾ ಅದೇ ದಲೈ ಲಾಮಾ ಆಗಿದ್ರ, ಟಿಬೆಟಿನ್ ಇದು. ಸೊ ಸೇಯಿಂಗ್ ವಾಟ್ ಈಸ್ ಹ್ಯಾಪಿನೆಸ್ ಅಂತ ನಾನು ಹುಡ್ಕೊಂಡು ಹೋದಾಗ ಇವೆಲ್ಲ ನಶ್ವರ ಅಂತೇಳಿ ಶಿ ಹಾಸ್ ಎಂಬ್ರೇಸ್ ಬುದ್ಧಿಸಮ್. ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಮಾತಾಡಿದ್ರು ಅಂತಂದ್ರೆ ಅದೆಲ್ಲ ಇದೆ ನೋಡಿ. ದ ವೀಕ್ ಇನ್ಸ್ಟಾಗ್ರಾಮ್, ಯಾರಾದ್ರೂ ಇಂಟ್ರೆಸ್ಟ್ ಇದ್ದವರು ಕೇಳಲಿ. ಶಿ ಸ್ಪೀಕ್ಸ್ ಸೋ ವೆರಿ ವೆಲ್.
ವೆರಿ ಗುಡ್. ಹೆಸರುಗಳು ನೋಡ್ಕೋಬೇಕು, ಹಾಪಿಸ್ಕೊಳ್ಬೇಕು.
ಇಲ್ಲ ಅದು ಫುಲ್ ಬರುತ್ತೆ ಅಲ್ಲ, ಇದು ದ ವೀಕ್ ಇನ್ಸ್ಟಾಗ್ರಾಮ್ ಅಲ್ಲಿ ಮಾಡಿದ್ರೆ ಬರುತ್ತೆ.
ವೀಕ್ ಇನ್ಸ್ಟಾಗ್ರಾಮ್
ಇನ್ಸ್ಟಾಗ್ರಾಮ್ ಅಲ್ಲಿ ಇಲ್ಲ.
ಶೇರ್ ಮಾಡ್ತೀನಿ.
ಎಸ್, ಓಕೆ, ಸಾರಿ ಮೇಡಮ್, ಆಯ್ತು. 9 ಗಂಟೆ 2 ನಿಮಿಷ.
ಇಲ್ಲ, ತುಂಬಾ ಖುಷಿ ಆಯ್ತು ನೀವು
Can we start? It is 9:04,
Yes.
9:03.
Yes. ವಸುಧಾ ಮೇಡಮ್
ಎಲ್ಲಿದ್ದಾರೆ? ಹೌದು, ಅವ್ರನ್ನೇ ಮರ್ತ್ಬಿಟ್ಟಿದೀವಲ್ಲ.
ಇದಾರೆ ಬಂದಿದ್ದಾರೆ. ವಸುಧಾ ಮೇಡಮ್,
ಸೂತ್ರಧಾರಿಣಿ.
Namaste madam, Hari Om Dhanvantari.
Hari Om Dhanvantari.
Very nice to see such a lovely energy in the beginning of the session. Very nice to have everybody here.
That is Tribhuvan.
Hello madam. So it's the Tribhuvan Foundation annakinta Tribhuvan family. So with very much immense pleasure, I would like to welcome you all to this warm late Sunday evening. Warm antane helake yakandre it is really hot Sunday.
It is.
ಇದು ತುಂಬಾ ವಿಶೇಷ. ಯಾಕೆಂದ್ರೆ ಇಷ್ಟು ಅಂದ್ರೆ ಅವರ್ ಸೆಷನ್ ಈಸ್ ಆಫ್ಟರ್ 9 o'clock. ಆದ್ರೂ ಸಂಡೇ ದಿನ ಎವ್ರಿಬಡಿ ಮೇಕ್ಸ್ ಟೈಮ್ ಟು ಬಿ ಹಿಯರ್ ಅಂಡ್ ಡಿಸ್ಕಷನ್ ಗೋಸ್ ಆನ್ maybe till 10:30 and wonderful discussions happen. So it's very special. ವೈದ್ಯ ಸಮ್ಮಿಲನ ಗೆ ಒಂದು ಕಳೆ ಬರುತ್ತೆ. So it's very nice. So being said this, respected dignitaries, honored guests and dear participants, it is with immense joy and deep reverence we, the Tribhuvan family, extend our heartfelt welcome to this wonderful gathering here. This Vaidya Sammelana, as I said, it's a very special gathering. The warmth is carried by each Vaidya. It is not just yet another seminar or webinar. Aldene, the warmth is carried in every Vaidya's heart, and the sharing, the knowledge exchanges immensely very nice. So I'm happy to be here with all of you. First of all, I would like to call upon Dr. Shruti to invoke the blessings of the Lord. Dr. Shruti.
Namaste, ma'am. Am I audible?
yes ma, yes.
Clear and audible, madam.
Yes, sir. Thank you. ವಿಘ್ನೇಶ್ವರ ನಿನಗೆ ಪ್ರಥಮ ಪ್ರಣಾಮ, ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ದಿವ್ಯನಾಮ. ವಿಘ್ನೇಶ್ವರ ನಿನಗೆ ಪ್ರಥಮ ಪ್ರಣಾಮ, ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ದಿವ್ಯನಾಮ. ವಿಘ್ನ ವಿನಾಶಕ ಬುದ್ಧಿ ಪ್ರದಾಯಕ, ವಿಘ್ನ ವಿನಾಶಕ ಬುದ್ಧಿ ಪ್ರದಾಯಕ, ವಿದ್ಯೆಯ ನೀಡೋ ಶ್ರೀವರದಾಯಕ. ಚರಣ ಕಮಲ ನಿನ್ನ ಪೂಜಿಪೆ ಅನುದಿನ, ಪಾವನಗೊಳಿಸು ಈ ಶಾಂತಿಧಾಮ, ಪಾವನಗೊಳಿಸು ಈ ಶಾಂತಿಧಾಮ. ವಿಘ್ನೇಶ್ವರ ನಿನಗೆ ಪ್ರಥಮ ಪ್ರಣಾಮ, ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ದಿವ್ಯನಾಮ. ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ದಿವ್ಯನಾಮ, ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ದಿವ್ಯನಾಮ. ॐ नमामि धन्वन्तरिम् आदिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरारुग्भयमृत्युनाशम् धातारमीशं विविधौषधीनां धन्वन्तरिं रमानाथं सर्वरोगनिवारकम् आयुर्वेदप्रवक्तारं वन्दे पीयूषदायकम् सर्वे जनाः सुखिनो भवन्तु सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः थैंक यू
That was wonderful. Thank you so much, Shruti, for setting the right intention, right mindset for a wonderful session ahead. Wherever there is excellence, brilliance, and greatness, it is but a manifestation of divine always. Today, we are truly blessed to be in the presence of such distinguished personalities whose achievements and contributions reflect this divine excellence. I request Dr. Gopal Krishna sir to give a brief introduction about our Tribhuvan Foundation and also officially welcome all the dignitaries today.
Om Shri Gurubhyo Namaha. Hari Om. Tribhuvan Holistic Health Foundation, which was started its journey as a small group of people 3 decades back under the able guidance of Dr. B.S. Nataraj and also Dr. K.S. Jayashree ma'am. It has passed many milestones. Now we have truly spread across the Tribhuvanas. The main motto of Tribhuvan Holistic Health Foundation is to initiate the Chintana in every Ayurvedic student and also every practitioner. May it be an academician or a practitioner or anybody who is interested in learning and practicing Ayurveda. Tribhuvan Holistic Health Foundation is there to give the guidance. It is to propagate the scientific thinking by making the Shastra Chintana, Dravya Chintana, and understanding the intricacies of the concepts of practicing Ayurveda in day-to-day life. It is not only to propagate the scientific thinking and understanding of Ayurveda, the Shastra, and also to identify the able people who are serving the society, the silent servers of the society, and also to honor the meritorious practitioners as well the students, awarding them when and the time permits and whenever it is necessary. Even we are giving a gold medal in RGHS every year under the name of Dr. B.S. Nataraj. To put our thoughts into action, workshops, health checkup camps, distribution of books, and also the hand-on learning. These things are done regularly in Tribhuvan Holistic Health Foundation. We have started to put everything into words through the website, and we are running 2 different WhatsApp groups, one particularly for the Vaidyas, another for the people and the family who are related to the Vaidyas. The Tribhuvan Vichara Vedike and also the Tribhuvan, the main WhatsApp group. Today we are here, the President Dr. K.S. Jayashree, Dr. Rangesh Parmesh, and my very good old friend Dr. C.S. Anil Kumar, who runs the Dixit Ayurveda Ayurdhama at Mysore, who is known to me past more than 3 decades. And he is doing human work there at Mysore. And his whole family, his wife, his children, his sister, and his brother-in-law, they are all doing different parts of Mysore, serving the society. I welcome you all, sir. I welcome you, madam.
Namaste.
I also welcome all the participants today who are here to really join with the Vaidya Sammilana. ನಿಜವಾಗ್ಲೂ ನನಗೆ ಬಹಳಷ್ಟು ಸತಿ ಅನ್ಸುತ್ತೆ ಇದು ಕೇವಲ ಸಮ್ಮೇಳನದ ರೀತಿ ಅಲ್ಲ, ಈ ಅನಿಲ್ ಕುಮಾರ್ ಅವರ ಜೊತೆ ಮುಖತಃ ಮಾತಾಡೋದಕ್ಕೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಿರೋದು ಇಂತಹ ಒಂದು ಸಮ್ಮಿಲನಕ್ಕೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಿರುವಂತಹದ್ದು ತ್ರಿಭುವನ್ ಹೋಲಿಸ್ಟಿಕ್ ಹೆಲ್ತ್ ಫೌಂಡೇಶನ್. I welcome you all the dignitaries and also the participants.
Thank you very much, sir. That was a very nice, brief and sweet introduction of our family. I request Dr. Ashwini to introduce our resource person. Dr. Ashwini.
Namaste. Good evening, all. At the outset, I extend my heartfelt gratitude to respected Dr. K.S. Jayashree ma'am and the entire organizing team and Tribhuwana family for giving me this wonderful opportunity to introduce today's esteemed guest speaker. It is indeed a moment of great honor and privilege for me to introduce our distinguished guest speaker of today's webinar, Dr. C.S. Anil Kumar Dixit sir, whose wisdom and contribution to Ayurveda continue to inspire many. Sir is a highly respected Ayurvedic practitioner, teacher, and researcher with 35 years of rich experience in the field of Ayurveda. He completed his BMS from Bangalore University in 1987 and his MD in Ayurveda Vata Chikitsa from Mysore University in 1997. Further strengthening his expertise, he also holds a postgraduate diploma in naturopathy and yoga. Sir began his professional journey by establishing Sanjeevani Nursing Home in Mysuru in 1991, one of the oldest Ayurveda nursing home of its kind. Later, in 1993, he founded the Dixit Health Clinic and Research Center at Saraswatipuram, Mysuru, which gained international recognition for its excellence in Ayurveda care. Continuing his vision, he dedicated Dixit Arogyadhama, a 15-bedded multi-speciality Ayurveda hospital, to the society in 2014. Sir has also made significant contribution to academics, having served as a faculty member at the renowned JSS Ayurved Medical College, Mysuru, for 13 years. His area of specialization includes Panchakarma therapies, particularly in the management of chronic diseases. Sir is an accomplished speaker and educator. He has presented scientific papers at numerous national and international conferences over the past 3 decades. He has conducted hands-on training and workshops for students and health workers, both in India and abroad, including in the USA and Canada, focusing on Ayurveda fundamentals, Panchakarma, and home remedies. Beyond clinical practice and teaching, Dr. Dixit is deeply involved in social and environmental causes. He serves as the Vice President of Sanjeevani Pratishtana Trust and Secretary of Daya Charitable Trust, working actively towards the conservation of medicinal plants. He is also associated with Maitri Charitable Trust, contributing to the welfare of mentally challenged children. With a strong commitment to community service, he regularly organizes free medical camps for economically weaker sections, providing consultations and medicines and follow care. Adding the unique dimensions to healing, Sir integrates music and wellness through program Ananda Arogya, conducted on every full moon day, promoting mind and body balance. On the personal front, Sir is married to Dr. Jayanti NV, a renowned gynecologist, and is blessed with 2 accomplished sons Dr. Ajay Kaushik, MBBS, university topper, and an orthopedic surgeon, and is now Chief Consultant and Director of Dixit Artho, Dixit Arogyadhama, and younger son, Abhay Kaushik, is a computer science engineer from BITS Pilani and uh, did MSc in Biosciences from University of Paris, is now pursuing PhD studies in neurosciences at Max Planck Institute for Brain and Cognition from Germany. With this brief introduction, I proudly present today's resource person, respected Dr. C.S. Anil Kumar Dixit sir, a distinguished scholar and Ayurveda practitioner, to this webinar. We eagerly look forward to gaining valuable insight from his wisdom and vast experience. With immense respect and gratitude, I now request Dr. C.S. Anil Kumar Dixit sir to kindly deliver his enlightening session. Over to you, sir. Thank you.
ॐ अनादिमव्ययं दिव्यं व्यापकं विश्वभेषजं त्रिकाल अबाधितं नित्यम् आयुर्वेदम् उपास्महे। ॐ रागादिरोगान् सततानुशक्तान् अशेषकायः प्रसृतान् अशेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै यो अपूर्ववैद्याय नमोऽस्तु तस्मै। Namaste all. I'm greatly honored to be here with you all. I'm here at the outset seeking the blessings of my respectful teacher, Dr. B.S. Nataraj sir, seeking the blessings of Jayashri Amma, my teacher who has brought me here in this august platform. I'm really very, very happy. I don't know whether I deserve it or not. I'm just here because of Jayashri Madam only, because she is like a mother, always bringing children to the limelight, and she showcases every person. And so I am here. After a long time of, teaching, say around 13, 14 years of teaching in the JSS Ayurveda Medical College, I left teaching as a profession, and then I came into just practice, clinical practice, and I don't know, I have forgotten my theories, and I'm mostly into the practice. Please forgive me for all the deviations from the theoretical subjects that we sometimes we need very much, but yet I seek your corrections, madam, and all the August, Anna like Rangesh Anna, who is with us today, and they are always my, mentors and correctors. So when madam asked me like which topic that I should, discuss on this day, I was like blank. Come on, any topic is okay, because anyway, I need to just tell whatever little I know only. So when I was asking about the topic, she told, well, Vata is the one which has been responsible for all the happenings within the system, within the body. And over various Srotas, how best we can manage Vata as a very prime, way of managing Vata in various diseases. So the topic was selected, managing Vata across all Vyadhita conditions. And it is a very huge topic. And it is so huge that only I can pick up a drop from that big topic and probably try to and like let you know what little I understand from this. Srotases, lot of debates regarding Srotases, 13 Srotases, 11 Srotases, or innumerable Srotases in the body. And the channels, all the discussions are there, and probably you would have gone through all of them also. But basically, on the clinical approach, I would like to just take the Srotas of Charaka and probably go a little deviation and pick up a few informations or probably my experiences that has helped me in managing. I recall my very initial days of Ayurveda, studying in my second year BAMS. Uh, I was in a hostel in Bengaluru. I keep telling stories, and this is one among the story. I was in a hostel in Bengaluru, Sri Ramakrishna students home, and there were a lot other students in different, taking different subjects and like disciplines like engineering and all. One, my engineering friend, who had a low back pain, because I was a student of Ayurveda, he approached me what best I can do to help the low back pain. I didn't know anything because I was just in second year, and I was told by my teachers again, because it is the Vata pain and it is Vata, and for Vata the best thing is Vatanulomana, and you do Vatanulomana and the low back pain will go. It is some very vague understanding of the second year topic. And then I didn't have anything other than Triphala, and I gave just Triphala because that's the only thing that I had. And I gave Triphala Churna, like I asked him to take like 1 teaspoon of Triphala Churna to be mixed in hot water and taken. And thank Ayurveda, thank Triphala, thank that boy's, belief in me. Come on. And the low backache is gone. Probably he would have had a good rest on that night. Whatever may be the reason, the low back is gone. And the best thing that he did was, and he was very happy, and he told, well, because of your triple achota, my backache is gone. I was happy because something good is happening. So like that, managing Vata started from my initial school days. I would always call it school days, like second year BAMS. And well, with the studies and then with my PG involvement and the guidance by my teachers and all, and trying to understand Vata, such a huge thing, not much that we could do. To help, to understand Vata at all. And when I came into the clinical practice, then the problems and so much vast, and to tackle them and all, keeping Vata into consideration, is a big, very big challenge. I would like to take up now with examples that I come across during the clinical practice. The Srotas, starting from Pranava Srotas. Pranava Srotas. And well, when we just think of Pranava Srotas, we always think about, like, as a practitioner, Shwasa Kasa Hika. And these are the very common, everyday problem for any practitioner. Shwasa and Kasa rather than Hika. Hika does come too, but more so with Shwasa and Kasa. Shwasa, well, we shall talk about Kasa. And, Kasa, managing Kasa and considering Vata as an important dosha in Kasa. As we know, we have different Kasa varieties like Vata Chikitsa, Pitta Chikitsa, Kapha Chikitsa, Sanipata Chikitsa, and all that. Kshatra Chikitsa, Kshaya Chikitsa. Well, keeping all that in mind, again, all the chronic Kasa will be all the Tridoshaja and more so Vata Pradhana. We do come across when there is a change in the weather or so, or probably a little apatya with water, we do come across with a simple pharyngitis, an irritation that comes into the throat and developing a Kasa. That's the first symptom any person would have with upper respiratory. So the Kasa, Vata Kasa, the dry cough that a person would pick up, and a lot of irritation in the throat, mainly the shula, toda. So I always think about it is Vata, and so, and the drugs, whatever has been mentioned, the dosage and the timings, they say it's always muhur muhuru with the Shwasa, Kasa, and Hika. The best among the drugs that we can think of is Sitopaladi Churna, that I always suggest or probably give because I dispense Sitopaladi Churna. I do make small mixes with Sitopaladi Churna. Sitopala and Yashti has made a wonderful combination in my practice. Yashti, Sitopala, sometimes I add some Amrita Sattva too to help. Amrita Sattva, like 1/4 teaspoon, added with Sitopaladi Churna 1 teaspoon and Madhyashti Churna 1 teaspoon, say around 2.5 spoon. I mix in the kalva and put it in the cover and give to the patient and say 1/4 spoon of this powder would be just sufficient for you. Forget about the dosage form suggested by the acharyas, like, 1 pala and all that. I give only, this is how I have picked up my practice, like 1/4 teaspoon of this powder combination. And the casa comes to such, it's such well managed. The patients, even today, after say 30 plus years of my practice, they come and ask me, give me that cough powder, give me this casa churna cough powder. And I always mix the same powder. I know I have many students who come and stay or practice with me. They have been watching and they have been just using, and the patient always says, I come here, take the casa churna, and the casa is gone. So this is regarding the casa, where I just manage Vata Chikitsa with Madhyashti Churna, and the best Anupana that I always suggest is Grita. So that makes a huge combination. Like when it is Kapha, it is Madhu, and when it is Vata, it is Grita. So Vata Chikitsa with Yashti Churna, sometimes with just Yashti Churna and Grita itself, the Vata Chikitsa can be managed. This is what I have seen. But to make it much palatable and tastier, Sitapaladi Churna, as you know, we have loved it, enjoyed the taste of Sitapaladi Churna. And the patients have accepted this so very well. Even today, say in every day, I would give this combination at least to 20% of my patients. Well, when it is casa, well, we can just do with similar other medicines, like think of rasa yogas like Ananda Bhairava Rasa or Tribhuna Kirti Rasa as it is required and all. That's a different aspect. Coming to Shwasa, which has always been a challenge, Tamaka Shwasa. And Tamaka Shwasa, we know it is Kapha Pradhana Tamaka Shwasa or Vata Pradhana Tamaka Shwasa, based on the, the productive Kapha. So very commonly with Vata Pradhana Tamaka Shwasa, where there is very less secretions, I would make the same combination of Sitopaladi Churna, Yashti, and sometimes Amrita Sattva. And the best other drug that I have picked up is Samira Pannagarasa. Samira Pannagarasa, say around 125 milligrams with the same combination, whatever I have suggested for the Vata Chikitsa. I just added Samira Panagaras, give Shwasakutararas, make it any other thing and make a combination. Samira Panagaras, I keep it in my shelf and I always take a little and then make powder and then mix and give. And this helps in very frequent coughs. You just add any other drugs. Think of Dashamula. This is another thing that my teachers have taught me. Dashamula Vasakarishta in Kafaja Shwasa, but we have Somasava available in the market. Somasava, Dashamula and Kanakasava I have tried in Shwasa. And Dashamula Rishta in Vataja, it because it is the best among the Vata, alleviating drugs. So this has helped. And again, though Asava Rishtas are to be taken after food, maybe twice a day. And now we have been eating several times a day. So maybe twice, thrice, it can be taken too. But the Churnam with the Samira Pannagaras, I have suggested very frequent, probably as an acute management, I have added Samira Pannagaras probably for around, like say around 45 days, I give Samira Pannagaras and I take Samira Pannagaras out and give the rest of the Churnam as to manage. Shwasakutararas, and other like other drugs which are available in the market. Think of Ephedrine, think of Astomap, and different other companies have come out with different Shwasa yogas. You can all give that and probably think about managing this Vata. Leave apart when we think of the panchakarma aspect of it. We do vamana in case of like kapha pradhana, shwasa and kasa, and we have been doing virechana, and virechana has helped a lot. And though not we can give virechana, think of giving a regular anulomana itself would help the best control of shwasa. Tamaketu virechanam, as we know. So tamaka, though in different diseases like udara, nitya virechana has been told. Like even in the tamaka, regular anulomana at least can help a lot. So anulomana, we have saw a lot of anuloma yogas available, and all are vata anulomana for sure. And so that would definitely help pick your anuloma yoga and then give along with any shwasa yogas that you would like to give. So this is how I manage Pranavahasrotas with Samira Pannaga, with Anulomana, and sometimes, naturally, and most of the times, Ghrita is the one that I have been picking up in most of the Vata increased conditions of Pranavahasrotas. Udaka Vahasrotas is a challenge. And the scope of Udaka Vahasrotas is, less understood by at least practitioners, though the teachers and professors have been dealing with Udaka Vahasrotas and all. When coming to the practice, the Udaka Vahasrotas, Drushti Lakshanas, we think of dryness in the mouth, dryness in the talu, and then dryness in the body, and all these, conditions which we simulate to the dehydrations and other conditions. Like probably there we can think of it is just Vata and Pitta, Trishna. These are the few things. So Vata and predominantly Vata and Pitta. These are the doshas that we can think of. And all the yogas that we have is to rehydrate, replenish with all the Vatahara Fantas and then Vatahara Kashayas and Manthas that our teachers have suggested. Like think of Draksha Mantha, think of Karjura Mantha. These manthas would enable us a lot. Now it is getting hot summer, and it's going hotter in the days to come too. So we need to. I always suggest my patients who come to me to have Sogde Berin Sharbatu. Nanari Sharbat is so good and so replenishing, and I have been suggesting also Madhipala Rasayana. Depending on the involvement of pitta, I would suggest either Sariba Sharbat or Madhipala Rasayana. I ask them to keep there in their bottles, keep Sogde Bear Sharbatu in your water, and then keep sipping all through. And these days, our software guys, patients, who are commonly dehydrated in their AC rooms, would require this support because they need to rehydrate well, keep sipping water, and let that water be with some Sogdeberu or some, these sharbats would help a lot. We have Draksha sharbats, and we can make different other sharbats. And of course, Sariba is the best among. And that replenishes, reduces Vata and Pitta both. And think of such things, Madhura Rasa, Snigdha, and especially Ghruta would help a lot. And especially even to think of like in say Budaka Vahasroto Dushti, the Karana, even Atapa has been suggested as the Karana. Ushna, Atyushna is one of the other reasons, and it is going to increase in this season too. So we need to have Ghruta in our food regularly, and drugs like Sagde Beru and all probably would be a very, very good idea. And we have a lot vegetables, as just now Dr. Rangesh has suggested. We need to go to the market, take the fresh vegetables and fruits which are available readily. And most of the summer fruits are vata calming and replenishing, pitta reducing. Think of melons, all the different types of melons that we have around with us, including draksha. Now it is in the season too. So, Udaka Srotas, probably these are the things that we should think of. We shall go ahead with Annavah Srotas. Annavah Srotas, there are challenges with Vata. And with the Annavah Srotas, we think of, the Shula, the Udara Shula. That's a very, very common thing. We always get perturbed whether we are able to manage at all this Shula. The Vataja, Pittaja, Kafaja Shulas and Sanipata Shulas, and think of Anadrava Shula, which is always challenging, and Parinama Shula. In all these Shulas, as even the texts have suggested, and I have tried this, Yashti and Shankha have helped a lot in managing Shula. Even for most of the gastritis and probably turning to gastric and duodenal ulcers, we call them all like acid peptic diseases. And with all these, my best combination is Yashti Madhuchurna with Shankha Basma. Yashtibadha Churna, Shankabhasma, and of course, sometimes adding Kamaduga Rasa to it, or Suta Shekara. Suta Shekara is one among the best drugs. Especially Swarna Suta Shekara Rasa in most of the chronic conditions. Even in, say, I have come across bulimias where Atyagni and conditions like Bhasmaka and Yashti, Shankha and Swarna Suta Shekara Rasa has helped a lot in them, and they have recovered well. I should tell you, very recently I came across chronic pancreatitis. Though there are remissions and there are relapses of chronic pancreatitis, Swarna Suta Shekara Rasa is something like the patient has understood it so much, taking medicines say for around 3 months with me, and she never comes to me. She goes to the shop, buys Swarna Suta Shekara Rasa herself, and she starts taking it, and she's getting better. Well, whether you encourage it or not, that is a different issue. I'm happy, people do take Swarna Suta Shekara by themselves when they have a problem with chronic pancreatitis too, where it is always a challenge. And Yashti Churna with Madhu, Amruta Sattva and Kamaduga Rasa, these are the very common drugs. And Yashti for Vata, I understand, Yashti for Pitta too. So for all inflammatory conditions that happens in the gastrium, Yashti and Shankha has helped a lot. So, of course, my practice is so limited to only a few. Sometimes I don't feel like trying a new drug, which is so common, has been told in the, even I do not take Kapardika Basma because I'm so happy with Shakya Basma. I have not tried that because it is my simple practice just has helped me. And I have been staying in the same cocoon, not coming out of it at all, of all these 30 years also. Well, and think of chronic conditions like Parinama Shula, duodenal ulcers, Prachutaha Balatsaha Sthanat Pichena Saha Murchitaha Vayumadaya Kurute Shuram. So here the Vata is the responsible person with which we get the Shula. So Vata corrections has to happen with Grita. So in all such conditions of Parinama Shula, chronic Shula, very chronic gastritis, chronic gastritis, APDs which are unexplainable. Now we have so many other infectious gastritis, and they always give antibiotics too. And I have my own reservations in encouraging antibiotics for H. pylori infections and all that we know them all. And in all such conditions, Gruta has helped a lot. Sukumara Gruta and Indukanta Gruta are the very common grutas that I use in chronic Udara Shulas. And as Shamana Sneha say something like 10 to 15 ml every day in the morning and the first thing in the morning, followed by a glass of hot water, sometimes with milk. And I ask them to wait until they are really hungry and then have little less spicy food. Okay, that's how I have been working on, and definitely they have been of much help. These grutas have been of much help to all these patients. And so my other combination would go with Shankabhasma with the Yashti Churna, and they ask them to take them Muhurmuhu. Sutashekara Rasa are similar, other Kamaduga Rasa, call it any other, like we have Lagusutashekara. So many drugs are available and you can try them all in combating. And Grita and Sutashekara and Yashti, they have helped a lot in most of these conditions like Shulas. And then we have Rasavaha Srotas. We have less, role to play in Rasavaha Srotas. Most of them are, Santarpadota Vikaras, as we see. And then Apatarpana Chikitsas have to be done in most of the Rasavaha Srota Vikaras. And we have less role for Vata. Yet there are drugs which are Tridoshahara and Vatahara too, among the one which are Apatarpaka too. So probably we have less things with Rasavaha Srota Vikaras. And then we have Raktavaha Srota Vikaras. And where we have a role, probably it is more so with Pitta, but yet we have the role of Vata in many Raktavaha Srota Vikaras. Think about, the Charma rogas that we come across, and especially so with Kitibha, Sidma, Ekakushta, or you call it psoriasis at the other instance. And we have eczemas, and which are always challenging, and we have dry eczemas, which are definitely Vata, responsible. And we have Udardas, which are Vata Pradhana Udardas. And so these areas we should think of the role of Vata. In most of these conditions, the best among the Vatahara Dravyas are again Ghritas. We have Pitta and Vatahara Ghritas available, as we all have practiced. Tiktaka Ghritas, Guru Tiktaka Ghritas, and different, like even any such Varanadi Ghrita. Many such Ghritas can be taken depending on the condition. And without Ghrita, managing Kushta is always a big problem. Without Ghrita, managing, I would say more specifically, psoriasis is very tough job. So psoriasis, because it is a dry condition, like a typical Vata condition, scaling happening all over, and irritations happening all over with inflammations, and the best among them is Gugulutika Diktaka. Nevertheless, I should say Panchakarma is inevitable for most of these chronic conditions. Say you have to have a very, very Samyak Snehapana. Samyak Lakshanas have to come invariably, and then wait until there are Samyak Snigdha Lakshanas, and then do Abhyangas, and then whatever. Say even in Pranava Srotas, like local management with think of Shwasa and Saindavadi Taila application on the chest and giving steam, or giving Sthanika Svedas like Tapas Vedas, they are just Vatahara Kriya only. I just missed it then, and I'm just recollecting and telling you now. Similarly, with kushtas, especially with psoriasis and alike conditions where Vata Pradhana conditions are seen. So Snehana and Swedana, they have to be done well. And then with that, probably we are able to combat the Vata and thereby the disease manifestation. Even after very good Sneha Yukta Virechana, Snigdha Virechana, the best among the Snigdha Virechaka Dravya is Nimbamritadi Erandam. Nimbamrutadi erindam, invariably I give it to most of the Kushta people. I mean, like, so patients with psoriasis. Let me be more specific. And regular anulomana can be done when we do it in our hospital setup. And I gave to the level of, like, very commonly I make Trivrut Leham from good companies like Kottakalari Vaidyashala, because I'm so happy using Kottakalari Vaidyashala's Trivrut Leham, followed by Nimamrutadi Erindam. I would add around 40 ml of that, 40 grams of Trivutleha, 40 grams of Nimamrutadi Erindam, mixed it together, and then this Sneha, I mean, this Virechana I give after the Snehapana and all the, Vishramakala Chikitsa. And, a very good Virechana with this would definitely enable to improve their, that definitely causes immunomodulation. And for the further management too, I would always suggest, Gugulu Tiktagagruta or Mahatiktagagruta, as the case may require, for the Shamanas Deha, followed by Nimbamrutadi and Taila as Anulomaka on a regular basis until the Vyadhi corrections happen. Along with, of course, you pick up your own dravyas, which are anti-kushta or anti, psoriatic conditions. You have 100 things in the market. You try your own, and probably we should not miss Grita. We should not miss Erinda Taila here. This is what I wanted to stress upon. And then coming to Mamsavaha Srotas. Mamsavaha Srotas, like Adi Mamsa, like Granthis have been suggested there. And I would like to just go a little out of this. Mamsavaha Srotas and Vata. Think of Mamsagata Vata and call it fibromyalgia, or call it, the simple muscle pain that we come across. Sthanika Abhyanga, and every one of us are so, recognized as, all the Ayurveda doctors are, Taila persons, and then we always apply, and then Abhyanga persons. So naturally, Abhyangas with any of the Vatahara Tailas, all the Tailas are Vatahara, and the best Shulahara Tailas you can just pick up, and starting from call it Mahavishagarbha Taila. Every other Taila is, Sacharadi Taila, Vishagarbha Taila, and, any Taila you can take off your choice and work on, and all the Tailas would so well. So probably what I do is, I have been working on Nirgundi Taila because I grow Nirgundi around my house and around my hospital. I pluck Nirgundi and make Nirgundi Taila and then put some Karpura in it, and I have called it Dixit Chulhara Tailam, a brand. And then this I have been using, and this is a hot cake. And sometimes even if I do not practice, and patients do come to my hospital to collect Chulhara Taila from me, and I'm happy. Only that is enough for me for my simple living. Which can meet my bread and butter. At least bread, though not butter. Well, so I would like to tell you, we need to, as Ayurveda practitioners, we need to have our own dravyas around us. As all our acharyas have suggested, the dravyas around us would be of much more effect. So I have grown Shigru near me. I have grown Nirgundi like in my vicinities, and I have been using them all. I cannot go and go to the shop to pick up drugs. I should always grow around me, and so I have done it. And all of you have been doing that also, I know. So I'm just trying to tell about what my practice is. So I have been using this Nirgundi Taila for most of the Abhyanga purposes. Definitely we are able to overcome this. And Mamsagata Vata, Snayugata Vata, these are extensions of Mamsa Vahasrotas. And then Siragata Vata, all these conditions we have been using different Tailas which are Vatahara. And then internally we know Gugulus work a lot, and all the Gugulus are Vatahara, as we know. And one among the best Gugulu that I have loved in my practice is Trayodashanga Gugulu. Trayodashanga Gugulu, and we have Trayodashanga Gugulu DS available in our markets. And so I have been using many of the double strength Trayodashanga Gugulu. And sometimes one of my friend used to tell Dr. Suresh, he always gives something like 6 tablet of Trayodashaga Gugulu 3 or 4 times a day. It is that quantity. And, he always says this much is required, otherwise it will not work well. So, I mean, this much is required, Trayodashaga Gugulu is of much, much help. And I should tell you, apart from Triyodishaga Gugulu, I've been working at Rasna Gugulu for Grudrasi and Vishwachi. Rasna Gugulu also, helps a lot in most of the Snayugata Vata, Mamsagata Vata conditions, and, very, very common yogas. I should never miss telling, one very important Rasaushadhi that I have been using is Mahavata Vidvamsaras. I don't know, I buy something like, my utilization of Mahabharata Vidvamsa is something like around 1 kg, 1 kilogram, or at least like half to 1 kilogram every 1 month. It is that much of Mahabharata Vidvamsa I have been using. And in most of these Shula-like conditions, call it Gurudrasi, give, I have been giving Triyodashaga Gugulu or say Rasna Gugulu. Along with that, I give Mahavata Vidvamsa invariably. We should always keep in mind that Mahavata Vidvamsaras is available in, Jayapala Yukta, Jayapala Mukta. Both are available, and definitely I have tried sometimes companies, Mahavata Vidvamsa with Jayapala, and the patient had come to me with a very bad face and having a lot of loose stools, and I was wondering what it was, and I then came to know that it contained Jayapala, and then probably we may avoid Jayapala. Only in case of necessary, we can pick that Mahavata Vidvamsa with Jayapala, and then give without Jayapala is available in the market, as we have Zandu company which is manufacturing Mahavata Vidvamsa, very small pill, easy to consume too, and we have other many companies have been managing to give good Mahavata Vidvamsa also. You select your company, be sure about it, and then Jayapala Mukta Mahavata Vidvamsaras. In the dose of 1 tablet 2 or 3 times a day, it can be given before food. Most of the Rasaushadhas can be given, probably have to be given before eating too. And so twice a day or thrice a day, depending on the need, Mahavata Vidvamsa. I have been giving in most of the conditions like cervical spondylosis, lumbar spondylosis and disc lesions, and lumbagos and Janushulas, and also I give Mahavata Vidvamsa invariably. And I have been giving Mahavata Vidvamsa in, Vata Kantaka, we call it calcaneal spur or plantar fasciitis. In most of these conditions, I have been giving Mahavata Vidvamsaras with any other drug which is required. Like you can add Kaishora Gokulu with Mahavata Vidvamsa, make a combination of your own, and which is helping a lot. And then coming to the next Srotas, Medova Srotas. Medova Srotas, though it is something like an Santarpanotha Vyadis that is thought of, like we have Medorogas, we have Pramehas coming into the same vicinity. Medorogas, less role for Vata there, though Vata invariably has been there. I would like to just stress upon Medoroga with arthritis, and where the role of Vata has taken over because of, arthritis. The Medoroga has picked up because they have been living sedentary because of arthritis. And think of giving, you need to work on Vata there to help arthritis, and then work on the Medoroga simultaneously. As I have been working on, in my hospital, naturally, it has become something like, geriatric hospital, and most of the people postmenopausal or probably after some age, they come to us with obesity or overweight along with arthritis. So Janubasti, Janulepas, followed by Apatarpana Chikitsa, think of doing Udvartanas, happening simultaneously. Sometimes Viruddha Chikitsas happen too. So I don't know. The best thing is I should give some results to the patient. If they can reduce some weight, also getting Sthanika Abhyangas and Sthanika, and I should tell you here, the modern concept of managing obesity with fats, isn't it? We called it, keto diet. I mean, people call it keto diet. Whether you accept or not, that has been a practice, and it is all our experiences also. When we take saru anna and saru only, and you digest it in, say, around 2 hours, and you have the same tili saru anna with 2 teaspoons of ghee, at least you have 4 hours for its digestion. And this gruta, 2 teaspoons of gruta with the same saru anna has helped, the gastric emptying time being delayed, which is good for the patient because he will not be hungry to again have another, plate of saru anna again, isn't it? So this is how I look into. So the role of vata, managing vata also is required with the gritas and snehas, even in case of obesity. And it is that we should reduce calories in obesity, not the fat. This is how I would like to look into it. Like to reduce the calories, like to reduce the sugars, sugar consumptions, like direct sugars or with gudas or different other materials, madhur things that we have around us, and definitely improve on tailas and ghrutas. And for all the obesity patients who come to me with arthritis too, I have been giving them taila panas than ghruta. Taila has been of much help in managing, obesity also. So, Tiladaila, Murchita Tiladaila, I make it at home in my hospital. And so we have been giving Tailapana. And Shamana Taila can also be given like that, regularly to manage obesity too. Probably, we may think of working on these aspects too. And naturally, the other Medogata Vikara are very, very challenging for the medical fraternity is Meha, Prameha. And the Prameha, and the worst among them is Madhumeha, the Vataja Prameha. And Vataja Prameha, the role of Vata management plays a very, very important role, as we know. We need to work on the vata, and so come to us, the best among the prameha yogas, even say Vasanta Kusumakara and all that, they are vatahara only on the first instance, and definitely they are prameha hara chikitsa. And in most of these conditions, we should always help them. Their gastric emptying time is maintained well, and their, gives nehas in Madhumeha. Madhumeha, snehas should be given, and then probably see that they have more roughage in their food, managing with more fibers in the food through vegetables, though not with fruit sources. Madhu has been prescribed as a sweetener by all Ayurveda texts, and the quality of Madhu is a question today. With all that, again, Madhu can be utilized too. This is how I would like to think about the management of Medo Rogas and the role of Vata there. And coming to Shukra Asthi, Tatra Asthi Nistito Vayuhu. So definitely Asthi, it is the Shula, Asti Shula, and we have Soshiriyata that is happening almost with every one of us, like getting into the geriatric age. We are getting, we are calling osteopenia, osteoporosis, a very common threat of the day, as most of us are mostly sedentary. Most of us, not the Ayurveda doctors here around. I'm talking about the other people in general. And and the biggest challenge is their sedentary habits, not utilizing the asthis and sandhis very properly, and developing this. And so vata getting increased. So none other than gruta. Gruta, take your own choice of gruta. And the best among the, Shamana Ushadas that I have been trying is Lakshadi Gugulu or Laksha Gugulu. Laksha Gugulu, I have been working on, Sandhi osteomas. I should tell you, in osteoma, I have tried with Laksha Gugulu, osteoma with osteoporosis. I have given to a gentleman of around 78 years, when the gentleman was brought to me with a swelling in the tibia, and severe osteoporosis happening in him. I have given him uh, Lakshadikugulu in the dose of 2 tablets twice a day as a maintenance dose for something like 6 years. And 6 years is such a big time. And very recently he died in his age of around 96 or so. And he was walking around, he was doing everything on himself. I mean, I'm just encouraged when I see a patient like that. I'm encouraged to practice. This is how I just want to continue. Lakshati Gugulu has been of much help in my family. My sister-in-law, who fell down and had fracture, and she had compression fractures of her T12 and T8. Probably I have started her Lakshadi Gugulu, and her recovery is much faster. And has been introduced, my son is an orthopedic surgeon, and he always tries to tell what best can be done. Now he has been seeing me giving Lakshadi Gugulu, and he is encouraged to give Lakshadi Gugulu in his practice, because no other orthopedic surgeon practices Laksha Gugulu, and he practices now Laksha Gugulu. He is an feather in his cap, because he has a new drug, because there is no other drug available other than giving calcium and vitamin D there. Okay, and he has been trying with Laksha Gugulu in osteoarthritis, and he feels so happy practicing it. I'm really very happy when things, when my wife starts giving Ashoka Rishta, and my son giving Laksha Gugulu in his practice, and this is so good. At least my influence, though I cannot make them Ayurveda doctors, I can help them practice some of a few of these few medicines, and that too with respect, that I should tell you this. Well, and this is asthigata rogas, and then in most of these conditions you have to manage vata through grita invariably, and think of Laksha Gugulu. And naturally we have so many other drugs, including Asti Shrunkala, and there are so many medications available, different combinations of Asti Shrunkala in the market. So, Asti Shrunkala, one of my good friend, Dr. D.N. Arun Kumar, probably many of you know here in Mysuru, he used to always tell, Asti Shrunkala, you just take one kanda of Asti Shrunkala, there are segments, and one segment you take and put it tight in a, in a cloth, and then when make a potali, like only the potali, only one piece of Asti Shrunkala is there, and boil it in rice. You put it in your cooker, or where you cook rice, and then the essence of Asti Shrunkala has percolated into rice, anna, and this anna I want you to take. With most of his patients, he has been trying this. I just wanted to share with you. I have told it to many people to hear. Because it is a home remedy, and probably you give whatever drugs you like, and suggest one thing with Sandhigata Vata or osteopenia or osteoporosis conditions, one shrunkala of, Asti shrunkala, one piece tied in cloth, cook it with water, and then take the cloth with the Asti shrunkala out, and you don't see any big change in the taste or flavor of rice, and you can just enjoy the rasam rice or sambar rice, and you have the benefits of Asti shrunkala in your food. So, in Asthigata Vata, it is of much help. In coming to Shukragata Vata, I don't know, I'm going out of. Oh, yes, I'm sorry. I'm sorry. I would like to stop it here if you are accept, please. I'm sorry, it is 10 o'clock.
You can continue for another 2-3 minutes.
Okay, ma. Okay, ma. Thank you.
Please.
Thank you for. Thank you. Only a few things that I should not miss to tell is Shukragata Vata. Shukragata Vata, again, it is a condition where Vata Prabalya is also very, very noted. Shodhana is very important. Gritas like Ashwagandha Grita, I have been trying in most of the cases with Shukradushtis, and then Artavadushti, Artava Srotas I have not dealt with, and Yoni Vyapat, as our teacher Jayashree Madam always has so elaborately, it is so fresh in my memories, so green in my memories. Her classes on Yoni Vyapat, and calling it all the, the Vata conditions, how we have to manage. It is so fresh and green in my memories. I have been trying with, Vata conditions, like think of Kashtartava. Just taking this. I'm a very small baby in front of Madam telling about Kashtartava here. And I have been trying with Chandra Prabhavati along with Mahavata Vidvamsa. Chandra Prabhavati with Mahavata Vidvamsa in Kashtartava conditions. I give them the whole of, the whole month. And the next periods, they have less issues, less problems with pain, abdomen, and, low back pain, and all other symptoms. Mahavata Vidvamsa has helped a lot. I give Ashokarishta along with Mahavata Vidvamsaras. And, Mahavata Vidvamsaras is so common in my practice. Every other patient, I give Mahavata Vidvamsaras. I have not touched the Pakshagata. I have not touched neurological diseases where, Vata is so important, and, we have been working on. I should always tell, when I'm talking about Vyadhita Srotas and PCODs are so common now, and Vata Chikitsa is also very, very important there. So I have been suggesting Rasaushadhi, including, Rajapravati Nivati and all are fine, but I have been using Mahavati Vidvams along with, any of these drugs, like Kanchanara Gugulu with Mahavata Vidvamsaras has helped a lot in PCO conditions and all. And well, in neurological conditions, nevertheless to say, Shodhana, Shamana, and think of Ekanga Viraras, and everybody has been practicing that, and I'm equally happy practicing that too. And I think I would like to stop it here. Okay. I don't know how far I could reach you. I know many of you have been much better than what I've been doing, but I just wanted to share with, because an opportunity, I'm really very, very happy to be with you all. Yes. Thank you, Amma.
Wonderful.
Much.
Wonderful, sir. Actually, to say about sir, he has been, we can tell him as an absolute Ayurveda practitioner. Why? Because as the health definition goes, not just the absence of disease, physical health, mental health, social well-being, how the definition goes, and our Ayurveda definition, how the Samadosha, Samagnisha, of course, everybody know that. You have been taking care of physical health by, of course, the Aushadhi and all, the mental health by your music therapy center, and also you've been the socialist and environmentalist, so you're also taking care of social well-being. So sir is like a absolute Ayurveda practitioner. And coming to the topic, like Vata is like quite a huge vast topic. It is like Lord Hanuman. We can't get catch of him at all. Also we know this Ashtama, what abilities he have, Arima, Garima, and all like that. Our Vata is also like that. It is like when it comes to control, when it is in the Vriddhi condition, when it goes to, so it is very erratic. So having a practice to balance such a complicated Vata is like extraordinary thing, sir. So you have been doing it so well, especially with such simple yogas. So simple, like the examples you stated, the Asti Shrunkalaman, the Lakshari Gugulu, it is so simple, but yet we forget using in our practice. So it is wonderful. It was a wonderful session, very simple, very doable, and everybody can practice at least many points from this right away from tomorrow in their clinics. Being said that, when Gita we say, Bhagavad Gita we say, Tadvidhi pranipatena pariprashnena sevaya upadekshanti niyate gnanam gnanina sattvadarshana. So by, of course, by the surrender to the gurus, the Lord, and also pariprashnena, by the prashna only we can get more and more knowledge. So we'll just move to the question answer session. I will request Dr. Neelkant sir to help sir in answering the question by reading out the questions. Over to you, sir.
Thank you, madam. We have one question. Will Asti Shrinkala cause itching while eating with the rice? Is a question, sir.
No, Asishrunkara with rice will not, because it is the quantity of rice would be more, and the irritation with Asishrunkara, when it is taken directly, it does. It irritates a lot, and we call it papad khara itself because it is so katu, and it definitely irritates. But in the rice, because of the rice qualities, it is minimized. You may almost do not feel it at all. And the best other thing is you are taking the Asishrunkala piece and you are removing it from the rice after it is cooked, and only the rice you have been eating with rasam, and the other the taste of the or the kara of the rasam would come to you, not the ashtashrunkala, but the qualities of ashtashrunkala would be there. Yes.
Should we remove the skin of Ashtishrunkala, sir?
What ma?
Should we remove the skin of Ashtishrunkala while cooking?
Ashtashrunkala, you please put it into the okay.
As it is.
Skin may be removed, may not be removed, because it is boiled there.
Okay, thank you, sir.
Thank you, sir. Regarding the avasthas of Vata, maybe Avrata Vata or Samsarga Vata or Sama Vata, Nirama Vata, in your practice, can you please put some light on that?
Correct. So this is a very, very important thing that I have missed a lot in this session. Correct. Okay. We need to understand whether it is samavastha of the vata or so, because very important. Otherwise, we would not be able to manage it at all. In samavata conditions, we need to select the drugs. Drug selection plays a very important role. So we have samavastha. And so to work on the samavastha, sometimes rasaushadhis would come to the rescue very fast, because small dose and we can do well. Think of Agnitundivati, or think of I have missed a very, very important thing. Using Ajamoda as one of the best Vatara, and Chitrika also as Vatara. Ajamoda especially. I have been trying Ajamoda. I asked them, 1 teaspoon of Ajamoda in 1 liter of water. Just boil water well, and then crush Ajamoda, and 1 teaspoon you put it into the water, and that the infusion would be there. And I asked them to continue with Ajamoda Jala regularly. Whatever Jala, probably 2 liters of that I want them to make, and then they should drink this not as just an Anupana. It is the Pana. It is the Jalapana is just Ajamoda Jala. So that can help in reducing the ama, because Ajamoda is a very good amahara too. So think of in amavata conditions too, Ajamoda Jala would be of much help. I have been trying, I should tell you, Udarta. In urticarias, very, very challenging. In urticaria too, Ajamoda and Jiraka, equal quantity. I have just asked them to boil, not to boil, because the volatile principle will go away. So boil 2 liters of water, put 2 teaspoons heap of each, and then once keep it ready and keep drinking this water, whether it is cold also doesn't matter. And that has helped in overcoming the the conditions like Vegas of Udarda. I should tell you, Kaishor Gugulu has helped a lot, because it is Vata again. Kaishor Gugulu, a drug of the choice that I have tried with urticarias. I'm talking about urticarias here. And in the dose of 2 tablets, 2 or 3 times a day initially. And the dependency on antihistamines have gradually reduced in time. With time, I would say from 1 month to 6 months, the urticaria has reduced significantly, and most of my patients have come out of even the Kaishor Gugulu, leave apart antihistamines, and they are doing so very well. I should tell you, the Kaishor Gugulu, along with Ajamoda Jala, Jiraka Jala, has helped. So in Samavastha, probably this is how we would like to work on. Simharada Gugulu is of much help in Samavastha, and then think of giving Kaishor Gugulu or any other Gugulu, Mahayogaraj Gugulu or so. Later, as a maintenance, we have to select the drugs for Samavastha. Samavata Lakshanas, you need to understand, like Gaurava, Stamba and all that, and then try working on it. Rasna Gugulu also would be working very well in Samavastha. Rasna is a very good Vatahara. And think of Shunthi. Shunthi is a Vatahara. So Shunti and Madhura Vipaka. So Shunti, Madhura Vipaka, and so probably think of adding Shunti in the food, or probably as a medicine, or Shunti Jala we can make. And as a pana itself, needless be Sahapana or, Anupana.
Very good.
I don't know if I have answered.
Yes.
Thank you, sir. So the Vata Chikitsa is very, very important, not just Vata alone. Yes, sir. Sir, in Tamakashwasa and COPD.
Yes.
Yeah. Management of that with Vata Vyadhi, Vata Chikitsa as such, any experiences you can share with, sir?
I have told you in the very beginning, I took up Vyadhita Srotas also in the first instance, and then talked about the common yogas like Samira Pannaga with Abraka Basma. Abraka Basma, I have just omitted there. Very common prescription is Abraka Basma Shataputi with Samira Pannagaras around 125 milligrams with Yeshti Badu Churna and Sitopaladi Churna. This is a very common yoga that I make myself and then give to the people. I dispense that actually. So that muhur the patient would take either in madhu or sometimes, mostly with the ghritam, and then sometimes with Nagavalli rasa, and so you can just pick up whatever is available with them easily and probably try with them. So would definitely work this way. Yes. COPD. Well, apart from that, I had told you also, Sthanika Abhyangas like Salvana Upanaha Sweda would definitely help. So, these are the supportive therapies. Salvana Upanaha, like, you can just take lavana and then boil it in Tiladaila, and then that you apply it and then give a good Swedana. It can be Tapas Sweda also, would be of much help. Yes. This is disease management. COPD will not simply go away with this. It is like we always know, it is yapia. Tamakashwa yapia. COPD is yapia. We should understand this. We are not clearing the problem off. If we can reduce the symptoms, would be good. If the recurrences, is reduced, is also very, very good. If the relapses are better, this is how we need to look into. And of course, lifestyle management, nevertheless to say, I have not touched that area, and that's important also. Yoga comes to a, must rescue in such conditions.
Thank you, sir. If there are any more questions, I request the participants to please post the questions in our WhatsApp group. We may request Anil sir to please give the answers in due course of time. Thank you, sir. Thank you for your time for the question and answer session.
Thank you.
Thank you, Neelkant sir. I request our beloved President, Dr. K.S. Jayashree Madam, to please give presidential note.
Thank you, dear Vasudha. Yes, I am very happy today because few months back we had Vata being a prime cause in all the diseases, or Vata being the dosha which is involved in all diseases, how to understand. I think Dr. Madhav Diggavi spoke on that. Now, in continuation, the second part we had today about managing Vata in various disorders. Excellently covered by my beloved friend, Dr. Anil Kumar. Thank you so much.
Thank you, Ma.
I have very few to say because as a presidential note, I'll just give, not a remark. So the purpose of this topic, managing Vata across Vyadhita Srotas, a clinical perspective. The topic we selected was because of the reference from Charaka, Tasyahi Kopad Ati Sarvarogaha, and Tasyahi Prashamnat Sarvasiddhaya. This is the reference we have from Charaka Samhita, Vatakala Kaliyam Adhyayam, wherein he says that because of Vata only, every disease can occur, and because of the pacification of rectification of Vata dosha, the disease can be, successful treatment could be given. Of course, we have so many attributes to Vata, like Vata, Tantra, Yantradharaha, so many things, Dhatu Vyuhana, Pravartakas Cheshta. So when we think of all this, every word has got impact on various functions of the body. So when every function is being programmed, controlled, and governed by Vata, certainly it has to be an involving factor in all the diseases. So this was the idea behind this particular topic. I just give one example how this varies. Before that, nowadays the more things are spoken about gut-brain axis. No, we have this Pakwadana Visheshataha is attributed to the best, major part for, location for Vata dosha. And after learning about this gut-brain axis, wherein it starting from endocrine to immune cells, everything is produced in gut, majority of them, even the neurotransmitters. So 90% of neurotransmitter, that serotonin, is in gut, whereas very less quantity is seen in brain. And we keep on thinking of brain and treating the brain, but actually it is in the gut which needs to be addressed. So similarly, the neurons nearly find this. I am just referring from an article. 500 million neurons and gut microbiota. These are the few very important things which govern the whole body, which has an impact on every part of the body. So that means to say, when they say Basti Vata Chikitsa, definitely they would have thought that that is going to be the measure in treating majority of the diseases. So, as he said, Sri Roga, being a Sri Roga person, anyway, now I am no way there. Long back I stopped teaching. I just get one example of yoni, as it is said. There is no yoni roga without vata. In that case, do we give the same treatment for all the 20 yoni vapadas, or any more yoni vapadas added to that? This is the question. So it is not so, because the approach is different. Like for Kashtatva, Dr. Anil has given a very simple remedy. And I would always think of hingu as an emergency thing. Just hingu fried in ghee. As you said, ghee is the best thing, accompanying factor. And ghee fried in, hingu fried in ghee is the best remedy to immediately bring down the pain, the acute phase. But to control, check the further in every cycle, because every time it happens, you treat for one cycle. Next cycle, it may be improved or may not be improved. It can repeat again. So Matra Basti becomes the best choice of treatment. 7 days treatment, if you give, it can continue for 6 months. Relief, definitely. Later, some people, it may be for a longer time, but in some, it may be a shorter period. But most of the times, Matra Basti becomes a very important thing there. But when you are treating an infertility case, especially with ovulatory dysfunction, then rather than treating Apanavayu, you need to treat Pranavayu. So, because when you are talking about pituitary ovarian axis, so then Prana is the most important one, which is influential, Pranavayu, in all types of endocrines, be it thyroid or insulin, whatever. So first thing we think of is the Pranavayu. So then the approach becomes Murdni Taila and Nasya. So there, other things, like intrauterine also may not be that effective when you focus on Pranavayu. On the other hand, if it is about Shukta Pratipadana, Shukra Pratipadana Kriya is receiving the Shukra and then helping it to reach the ovum. So till that time, say till it enters, Shukra has got its own motility. Later, it doesn't have a motility. So then the environment in the yoni is most important, especially the ciliary body. The ciliary body is actually compared with the vata only again. So if that has to be treated, Vanavayu has to be focused. So if you want to focus Vanavayu, most important is Abhyanga, Sarvadehika Abhyanga, Sarvacharaha Vyana. So Abhyanga Sveda becomes the most important one, and of course the Basti. So in that way it differs. Similarly with Shukra also, wherever the morphological factors are affected, tailless or headless or improperly formed, small, big, all these goes to like Karta Garbhakriti now. Similarly, even the Akriti of Shukra is also influenced by Vata. Any program for that matter. even malignancy for that matter. See, the cells forget their behavior and enormous growth results in malignancy. So that is again the programming is being affected. So there also you have to address Vata, but Vata alone may not be of use. If there is a growth, you have to remove it. Of course, maybe chemo, maybe radiation, or maybe surgery. That's different. But the main causative thing is this. So that's what even in genomics, if you go further, it is the Vata which takes a bigger role in that. So our focus becomes varied based on the disease, based on the disease status, based on the dhatu affected. Like, I'm sorry, Anil, I just differ when you speak. Rasavaha Srotas, we don't concentrate on Vata forward. But I feel we concentrate more on Vata only. Because all these, like when you say Rasat, Stanyam and Arthava, that Arthava comes is the hormones which are present in Rasadhatu. Because you assess the functioning of the whole reproductive system through Rasa. Isn't it? So then you'll have to address that only, mainly. So that again becomes either the pranavayu or the vanavayu. If the production is there, but the circulation is not proper, then address vanavayu. If the production itself is hampered, then address there at the root. So in that way, the approach, adaptation of Vata Hara Chikitsas vary from place to place, Srotas to Srotas, condition to condition. So this we have to think of further. Similarly, when you come to the drugs, like Hingu can reduce Shula, but it cannot reduce Asti Shula. You know, once we had to work on Vedana Hara. Then everybody says there is no Vedana without Vata. So all Vata should have been Vedana Hara. It's not so. All Vedana Haras are not Vata Hara alone, and all Vata Haras need not be Vedana Hara. So for that you'll have to think how Vedana is produced. Vedana needs an Adhisthana also. Vata is a dosha, okay, but you cannot perceive it. But always it needs an Adhisthana, and that Adhisthana could be any dhatu or any organ. So based on that organ's function, structure, the approach varies. This is how we need to, like in, what is that? Reflex disorders. You were mentioning about gastric reflex disorders. So there again, it appears Vata has increased because they have regurgitation. Udgara is more. But their immediate Vata treatment will not help them. Rather, Virechana helps there. So we need to go into such details and then manage Vata all over. I think my time is over. I'll stop here. There are a few more things. Anyway, we'll just think it in later sometime. So thank you very much, Anil. We are very, very happy to have you.
Thank you,
And you
Amma.
have much more things to tell us. We would be very happy to have you in future again. Thank you so much, and thank you all of you.
Very much. Thank you very much.
Thank you so much, ma'am. So we have come to the end of the session, though it is not the end, it is only beginning of the discussion of Vata. But it's my privilege to propose the vote of thanks for today's enlightening webinar. Definitely, it was a brainstorming session where it has set new ways and new perspective to look at Vata. So on behalf of Tribhuvan Foundation, I express my heartfelt gratitude to our distinguished speaker today, whose profound knowledge and practical insights have enriched us immensely. So your dedication towards preserving and advancing the science of Ayurveda is truly inspiring, sir. I extend sincere thanks to all the respected doctors here and the participants who has joined us today. Especially we have Dr. Chakravarti sir from Chennai.
Thank you, sir.
Thank you, sir. Thank you for being here. Dr. Rangesh Parmesh sir from Himalaya Wellness, of course. Sir is a stalwart. We also have just a second. We also have Dr. A.R.V. Murthy sir, Dr. Rajshekar Busnurmat sir, and of course our Vice President Dr. Rudra Gowda sir. We are very happy to have you all. Also my gratitude to our technical, Yojak Samiti, especially Dr. Neil Kansar, who takes in charge of organizing everything and stands behind a successful session. Thank you, madam, for creating such a wonderful platform for us. Actually, there is a verse in Gita also which says, Yadyadacharati Shreshta Devetara Janaha Sa Yat Pramanam Kurute Lokasta Dhanuvartate. Great individuals set the path for society, for the youngsters like us to learn. Their actions become a guiding light, of course, for others to follow. We are privileged to have among us such an inspiring leader like madam. Thank you for creating this platform, first of all, to have this continuous knowledge. Thank you, madam. Thank you, one and all. Shubharatri.
Thank you. Very good.
Thank you, one and all. Namaste.
Thank you. ಹೊರಟ್ಬಿಟ್ರಾ ಎಲ್ಲ? ಮಮತಮ್ಮನವರಿದ್ದಾರೆ, ಎಲ್ರಿ ಬನ್ರಿ. ಮಮತಾ ಊಟ ಮಾಡ್ತಾರೆ. ನೀಲಕಂಠ ಹೇಗಿದ್ದೀರಿ?
ಚೆನ್ನಾಗಿದ್ದೇನೆ.
ನೀವು ಚೆನ್ನಾಗಿ ಕಾಣಿಸ್ತಾ ಇದ್ದೀರಾ ಮೇಡಮ್.
ಎಲ್ಲಿದ್ದೀರಾ? ಬಂದ್ಬಿಟ್ರಾ ನೀವು? ಆಂಜನೇಯನ.
ಥ್ಯಾಂಕ್ ಯು ಮಂಜುಳಾ ಮೇಡಮ್. She could join, ಪಾಪ ಆಗಲ್ಲ ಅಂದಿದ್ರು. ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್.
ಕಾರಲ್ಲಿ ಬರ್ತಾ ಇದ್ದೆ, ಬಟ್ ಆನ್ ಮಾಡ್ಕೊಂಡೇ ಇದ್ದೆ. ಅವ್ರದ್ದು ಕ್ವಶನ್ ಆನ್ಸರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರಲ್ಲ, ವಸುಧಾ ಅವರು ಕ್ವಶನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಸಕ್ ಹೇಳಿದ್ರಲ್ಲ, ಅವಾಗೆ ಆನ್ ಮಾಡಿದೆ.
ವೆರಿ ಗುಡ್.
ಕಾರಲ್ಲಿ ಜಾಯ್ನ್ ಆಗಿದ್ರಿ ಪಾಪ ಮೇಡಮ್. ಕಾರಲ್ಲಿ ಇದ್ದೇನೆ ಜಾಯ್ನ್ ಆಗಿದ್ರಿ ಮೇಡಮ್. ಥ್ಯಾಂಕ್ ಯು.
ಯಾಕೆ?
ಹಲೋ
ಸಂದೀಪ್ ಲೋಹಿಯಾ.
ನಾನ್ ಏನ್ ಅನ್ಕೊಂಡೆ ಗೊತ್ತಾ, ಕೊನೆಯಲ್ಲಂತೂ ಮಾತಾಡ್ತಾ ಇರ್ತಾರೆ ಕೇಳಿಸ್ಕೊತೀನಿ ಅಂತ, ಬಟ್ ಇನ್ನು ಪಾಠನೇ ಆಗ್ತಾ ಇತ್ತು. ಕೇಳಿಸ್ಕೊಂಡೆ.
ಡಾಕ್ಟರ್ ಸಂದೀಪ್
ಶ್ರೀನಿವಾಸ್ ಸರ್,
ಶ್ರೀನಿವಾಸ್
ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ. ಶ್ರೀನಿವಾಸ್
ಹೇಗಿದ್ದೀರಿ? ಕಾರೊಳಗೆ ರಥದಲ್ಲಿ ಬರ್ತಾ ಇದ್ದಾರೆ ನೋಡು. ಈ ಕಡೆ ಮುಖ ಮಾಡಪ್ಪ. ನೀವು ಹಾಡಕ್ ಹೋಗಿದ್ರ ಕೇಳಕ್ ಹೋಗಿದ್ರಾ?
ಇಲ್ಲ ಮೇಡಮ್,
ಈಗ ಚೆನ್ನಾಗಿದೆ ಹಾಡಕ್ಕೆ. ಅದೇನ್ ತಲೆಗ್ ಟೋಪಿ, ಚಳಿನಾ? ಚಿಕ್ಕಮಗಳೂರು. ವಸಿದಾ, ಯು ಡಿಡ್ ವೆಲ್. ಏನ್ ಭಗವದ್ಗೀತೆ ಅದಷ್ಟೊಂದು ಕೋಟ್ ಮಾಡ್ಬಿಟ್ಟ ನೀನು?
ಯಾಕಂದ್ರೆ ಅಲ್ಲಿ ಇರೋದು ಜಯಶ್ರೀ ಮೇಡಮ್ ಅಲ್ವಾ, ನೋಡುತ್ತೆ ಕೃಷ್ಣ.
ಇಲ್ಲ
ಪಾಪ. ಅನಿಲ್ ಗೋಪಿ ಚೆನ್ನಾಗಿದ್ಯಾ? ಊಟ ಮಾಡ್ಬೇಕಾ? ಶೇಷಾಚಲ ಬಂದಿಲ್ಲ ಅಲ್ಲ ಇವತ್ತು?
ಶೇಷಾಚಲ ನನ್ ಜೊತೆಲಿ ಇದ್ರು, ಅವ್ರ ಬೈಕಲ್ಲಿ ಹೋಗ್ತಾ ಇರ್ತಾರಲ್ಲ, ಜಾಯ್ನ್ ಆಗಿಲ್ಲ. ನಾನೇನ್ ಡ್ರೈವ್ ಮಾಡಲ್ಲ, ಕಾರ್ ಕುತ್ಕೊಂಡ್ ಬಂದೆ.
ರಾಣಿ ತರ ಕುತ್ಕೊಂಡ್ ಕೇಳ್ತಾ ಇದ್ರ
ಮೇಡಮ್? ನಾನು ಇದೀನಿ, ನನ್ನ ಬಿಟ್ಟು ಎಲ್ಲಾರನು ಕೇಳ್ತಾ ಇದೀರಲ್ಲ.
ಕೇಳಿದ್ರೆ ಚಂದ್ರಕಲಾ ಎಲ್ಲೋದೆ ಅಂತ ಅವಾಗ್ಲೇ ನೀ ಕೇಳಿಸ್ಕೊಳ್ತೀನಿ.
ಇಲ್ಲ
ಹೇಳಿಲ್ವಾ?
ಹೇಳಿಲ್ಲ ಚಂದ್ರಿಕಲಾ.
ಬಿಡಿ, ಯಾಕೆ ಬಿಡಿ, ನಾವೆಲ್ಲ ಬೇಡ ಬಿಡಿ ಇವಾಗ.
ಯಾಕೆ? ಯಾರು ಸಿಕ್ಕಿದ್ರು ನಂಗೆ ಹೊಸಬ್ರು?
ನಿಮಗೆ ಯಾರು ಸಿಕ್ಕಿದ್ರು ಅದನ್ನ ಹೇಳಿ ಫಸ್ಟ್.
ಯಾರು ಸಿಕ್ಕಲ್ಲ ನನಗ್, ನಾನೇ. ಅನಿಲ್ ಕುಮಾರ್ ಹೊರಟೋಗ್ಬಿಟ್ರಾ?
ಅವ್ರು ಆಗ್ಲೇ.
ಪಾಪ. ಕನ್ಕ್ಲೂಡಿಂಗ್ ಮಾಡಿದ್ನ
ಅದರ್ಸ್ ಜಾಯಿಂಟ್ ಎಲ್ಲರಿಗಿಂತ ಮುಂಚೆನೆ ಅವರು 40ಕ್ಕೇನೆ ಇದ್ರು
ನೋಡಿ. ನಮ್ ಜನ ಎಲ್ಲ ಊಟ ಗೀಟ ಮಾಡ್ಕೊಂಡ್ ನೋಡಿ, ಮಮತಾ ಮಧ್ಯದಲ್ಲಿ ಊಟ ಮಾಡಕ್ ಹೋಗಿದ್ರು ಅಲ್ವಾ? ನೋಡ್ತೀಯಾ? ಅದಕ್ಕೆ ಇವಾಗ
ನಿಮ್ ಕಾಲಿಂದ ತಿನ್ಬಿಟ್ಟಿದೀನಿ.
ನಾನು 6ವರೆಗೆ ತಿನ್ಬಿಟ್ಟು.
ಇಷ್ಟೊತ್ತಿಗೆ ಹಶ್ವಾಗ್ಬಿಡಲ್ವಾ? 6ವರೆಗೆಲ್ಲ ಊಟ ಮಾಡ್ಬಿಟ್ರೆ?
ನಾಳೆ 10 ಗಂಟೆಗೆ ಚುಳ್ಳು ಅನ್ಸುತ್ತೆ, ಏನು ಕೊಡದೇ ಇದ್ರೆ. ಇದ್ಯಾರು? ಸಂದೀಪ್ ಏನೋ ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ.
ಮೋಸ್ಟ್ಲಿ ಮ್ಯಾಮ್, ನಾನು ಪತಂಜಲಿ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಹಾಕಿದ್ದೆ, ಅಲ್ಲಿಂದ ಜಾಯಿನ್ ಆಗಿರ್ಬೇಕು ಅನ್ಸುತ್ತೆ.
ರಾಮದೇವ್ ಇದ್ದಾರೆ ನೋಡಿ ಪಕ್ಕದಲ್ಲೇ, ಫೋಟೋದಲ್ಲಿ.